Did you know that women make up 70% of the global health workforce? But if I asked you how many women actually occupy leadership positions, you might be staggered by the response. The answer is only 25%. So let that just sink in. Women hold only 25% of leadership roles, even though they make up the bulk of the global health workforce. This is a staggering disparity, and one that has become even more evident as the world emerges from the shadows of a 2-year-long pandemic that isn't quite over. But look at this. In many countries, it was overwhelmingly men who were in charge of the COVID response. In fact, in the United Kingdom, it was 100% men in leadership roles when it came to COVID decision making. That number only slightly improved in the United States of America, where 93% of COVID decision makers were women. And here in India, there's actually a dramatic improvement in the numbers, but still not enough. That number, if you actually turn your focus to what was happening here in India, is about 86%. So 86% of COVID decision makers in India were men, and actually that number is better than the United Kingdom, or in fact, the United States. And here's another startling statistic before we introduce our panel of healthcare leaders today at the We the Women Global Townhall. A Yale University survey actually found that male scientists were paid on average $4,000 more per year than women doing exactly the same work at exactly the same level. So this is the irony. Women are the backbone of the global healthcare workforce, and yet there continues to be a massive disparity in how many of them actually hold leadership positions. Well, here in India, you actually have many women in these leadership roles, especially when it comes to healthcare management. Let's introduce some of the world's best, most accomplished voices, healthcare leaders, as it were, on the We the Women Global Town Hall today. And let's bring up our speakers for this very, very important and critical conversation. If we can see them now, yes, I am joined by Ameera Shah. Ameera Shah has single-handedly grown the Metropolis group from what was a single laboratory run by her father to the kind of global chain of laboratories and hospitals that it is now. Welcome, Ms. Shah, to the program. We're joined from the United States of America today by Dr. Joan Benson, who's an executive director at Merck, one of the biggest pharmaceutical companies in the world. We're also joined from WomenLift, which is at the forefront of looking at public health and women and the intersection of those issues, by Dr. Shagun Sabarwal, who is WomenLift's director here out of India. Welcome, Shagun, to the program. And last but never the least, we're joined by Ramaji. Ramaji is what in India is called an asha worker, or a community healthcare worker. The asha workers literally went door to door at the height of the pandemic, first spreading awareness about the need to wear masks and then the need to get vaccinated. Dr. Sangita Reddy is trying to join us from Thailand. We have literally a global panel. I know Ms. Shah kindly adjusted her time. She's in Dubai. Dr. Benson is in the United States of America. And Sangita Reddy, we're hoping will also be able to make that link work as we begin this conversation. So let me start with you, Ameera, if I may. One of your most quotable quotes is that women have to learn to punt on themselves, and that's what you did. Your father was much more cautious, much more conservative in terms of his approach to the diagnostic laboratories that your family then used to run back in 2001. And today, in 2021, the Metropolis Group is a behemoth. Where did you get the confidence to punt on yourself from, especially when you look at that staggering sort of disparity in numbers that I just read out for our audience, Ameera?
Hi, Barkha. Happy to be here. One thing which I can definitely credit my parents for was that they encouraged me to be very, very independent and adventurous at a very young age. So whether it was hiking from the time I was 9 and 10, whether it was traveling internationally alone by the time I was 15, there was never a restriction in terms of trying new things and finding my own way. There was never this pressure in India of society and taboos, social stigmas, or what will this one think and what will that one think. I never grew up with any of that, so I was truly privileged. But I think finding confidence is really up to each one of us. I too suffered with self-esteem issues, not so long ago, 8, 9, 10 years ago. And it's about
Can you
digging
can
deep
you
to
can you talk a little bit? I'm sorry, I'm interrupting you there, but when people hear someone as powerful as yourself, someone as accomplished as yourself, saying even you grappled with self-esteem issues, can you possibly share a little bit about what those issues were and how you got past them?
No, absolutely. I mean, I think each of us, especially in a place like India, we grew up with so many ideas. Even though my parents didn't, suggest it, but you grew up in a society where, as a woman, you are expected to be successful at two main roles: as a wife and as a mother. And everything else, frankly, doesn't matter as much, right? You could be the most powerful woman in the country, but if you ain't a good mother and a good wife, it means nothing. And there are many other facets to it. So I think I found myself sometimes not always excelling at all these other roles that I felt were truly embodied an Indian woman. Cooking at home and taking care of the family and having children at a certain age, being a wife at a certain age, and just generally, I think I didn't trust my own emotions and my own instincts. And that's why I say self esteem issues. It's really not so much about not having the confidence to speak in a room. I had plenty of that. But internally, to trust my own emotions and not doubt myself was a big battle that I had to fight. And really, I found the only solution to it was actually to confront exactly the fear that you have. Because that's the only way when you actually go through that fear and come out on the other side is when you learn that actually it wasn't so bad. And the next time around, I have much more confidence to do it. And that's the
Well,
mantra that I've been practicing.
yeah, I'd love to hear more about that, but I was reminded of Indra Nooyi's famous sort of story about how she comes home to tell her mom that she's become the PepsiCo chair and the CEO, and the mom says, well, leave your crown in the garage. You forgot to get milk home today. So, when you point, Ameera, to the fact that, you can be as accomplished, as powerful as one can imagine, it's still not enough in a cultural context. I think you make a really important point. Let me switch that to Dr. Joan Benson and ask you, Joan, if your experience was different. How hard was it for you to break into the leadership role that you today lead from, Joan?
It's interesting listening to Ameera talk about, sort of having confidence, issues, and as a well-established, woman in her own field. And I'll tell you that it was no different for me. Externally, you're exuding all of that confidence, but internally, you're crumbling. And it just seems to me to be quite a contradiction, because you ask yourself, how can you be so confident, outwardly in your in your interactions and talking to people, meeting with high-powered people externally, but yet inside of you, as you're doing that, all is not well. And so it was no different. Amira's experience was no different than mine. And so how did I break through that, and entering into a leadership role at Merck? I think for me, it was just knowing that, I come a long way. I'm African by birth, and coming into a developed nation and having all the opportunities that have been afforded of me. And if I don't do it, then who? If I don't rise up to the occasion, the needs are enormous. And as a woman, I felt that, and as a physician by training, I felt that, I'll be doing myself and young girls who are looking up to me a disservice if I don't sort of get away from that crumbling inside and show that I can do this and you can do this as well.
And what would you say, Joan, has been the toughest sort of hurdle? Was it family? Was it society? Was it? I remember Soumya Swaminathan, who's the chief scientist at the World Health Organization, said, "We the Women," in its previous edition, that there were times when she was the only woman in the room, and all the men looked at her like she was like a fish out of water.
Yeah. In most situations that I find myself in, conversations that I find myself, and usually the only woman, and sometimes the only woman of color. For me, it was going into those meetings and not thinking, I'm a woman of color. I should not be here. The minute I walk into that room, I have to shelve all of that. I have to put that aside and say, I'm coming in here with all of my knowledge, with all of my experience. And that's what people are looking to, hear from me. And that's what I can give. So I would defeat myself if I walk into that room thinking, I'm a woman and I'm a woman of color. It just does not even rise to the surface for me. I'm going in there and there's no gender when I walk into that room. There's no color when I walk into the room.
That is an interesting comment. Yeah, in your mind, you're degendering and in a sense disowning, or for that moment, you're being purely professional. But is that even possible? There's a reason that I've started with the personal journeys of all of you, and we'll come to the larger sort of disparities in sort of, what's happening with women, even with access to the COVID vaccine, there's a disparity. And I know, Joan, you've done a lot of work in that space. But let me bring in Dr. Shagun Sabarwal. Shagun, how has this journey been for you? I know that a lot of the data we cited, WomenLift has spent years working on these numbers. A lot of those numbers are from your surveys. When you look at this disparity, 70% of the global workforce in the healthcare sector made up by women, 25% leadership positions. And I know that those numbers fall even more in low-income or developing countries. Let's talk about you first. Has it been tough for you to reach this point in your life? What are the demons, the battles that you had to fight, Shagun?
Yeah, thanks, Barkha. First of all, it's a real pleasure to be here. I think I'll start by saying that, I think all of us should also recognize the privilege that we have, even in a country like India. And one can't help but be conscious that I have grown up in a family which was, again, very supportive. We're a family of 3 sisters. We belong to North India, where, not having a brother is often a comment that outsiders make. Oh my God, you don't have a brother and you're 3 sisters. So you kind of grow up with that. But then when you have really supportive parents who think that, a woman can't really, is no less, and they keep pushing you forward, I think some of those things start to kind of matter less. But as you start growing up, you do start seeing that not everyone around you has that privilege, right? And at every point in India, I think what Ameera was saying is very true, that there is a notion of what a perfect woman should be, or what a perfect girl should look like. And I think that while I have been very lucky, because I have kind of also been more in the development sector, and again in organizations that are often women-led. So I'm very fortunate to have these role models, to have mentors that also bring that empathy, But I do think that since you talked about data, I do want to mention that a very recent study that we did, where we did a lot of qualitative, in-depth interviews with mid-career women working in health across India, East Africa, and even North America, one of the big barriers that came up was this idea of not having mentors, not having enough support. So I do want to have like this call to action, and I know we'll go into this later, but personally, I have really gained a lot from having this support throughout. And this support is not just about professional, it is also about juggling your life, getting the right type of guidance, counseling the self-doubt that we are often kind of, that eats us in. How do we get rid of it? So that's what I would say.
Yeah, and it's interesting you speak about what happens in particular in South Asian families when they're only daughters. Dr. Sangita Reddy, who was supposed to be part of this conversation, and I'm told is still struggling on a phone link from Thailand where she's traveling. She once shared a story about how their 4 daughters who were at the helm of the Apollo hospitals, and she said, our father was always described as poor Dr. Reddy because he had 4 daughters, and our whole task was one day to get to a point where people would say lucky Dr. Reddy because he has 4 daughters. Talking about privilege, Rama ji hamare saath hai. I will translate a little bit of what's been said for Rama, and then I'll translate back for Joan in particular, and for sections of our audience who don't understand Hindi. What she's saying, Namaste Rama ji, आप ये community health की space में कैसे आई, और आपको किस तरह की कठिनाई हुई? क्या परिवार की तरफ से कुछ प्रेशर हुआ कि भाई काम मत करो, घर में रहो, पहले घर की देखभाल करो? पहले तो आप बताइए, आप आशा वर्कर बनी ही कैसे?
मैम, मैं 2016 में मैंने आशा वर्कर का ज्वाइन करा था। मुझे लोगों की हेल्प करने में बहुत अच्छा लगता था कि मैं किसी तरीके से उनकी मदद कर सकूं। तो मैं 2016 में आशा वर्कर मैंने ज्वाइन करा था, और जब फर्स्ट पेंडेमिक में मैंने काम करा था तो उस समय बहुत सब लोग डरे हुए थे, मेरे हस्बैंड भी बहुत डरे हुए थे, इवन मेरा बच्चा बहुत ज़्यादा डरा हुआ था। वो मुझे बार-बार बोल रहा था, "मम्मी नहीं जाना अपने काम पे, आप छोड़ दो। आप कोविड पेशेंट के साथ काम करने जाते हो, अगर आपको कुछ हो गया तो मैं अपने आप को भी मार दूँगा।" तो वो बहुत ज़्यादा था प्रेशर फैमिली की तरफ से। लेकिन क्योंकि हमारे पर भी प्रेशर था कि जब आपने जॉइन करा था तब उन्होंने ये बोला था कि अगर ऐसी कोई वो होगी तो आप छोड़ नहीं सकते काम को। तो उस समय मैं ये छोड़ना चाहती थी अपने फैमिली प्रेशर की वजह से, लेकिन कहीं न कहीं जो मुझे अपनी नीड भी थी और नहीं छोड़ सकती थी, ये भी एक कारण था। तो मैं इसीलिए इस काम को मैंने कंटिन्यू करा। लेकिन प्रॉब्लम्स तो हाँ, बहुत प्रॉब्लम्स आई, बहुत फेस करा मैंने।
यहाँ पर बात चल रही है कि औरतें जो हैं 70% वर्कफोर्स है जहाँ पे हेल्थ केयर की बात आती है, लेकिन सिर्फ 25% औरतें लीडरशिप पोजीशंस में रोल लेती हैं। मैं आपसे पूछना चाहूंगी, आपको लगता है कि औरतों को बहुत मुश्किल होती है आदमियों के मुताबिक ये काम करने में?
बिल्कुल, बहुत ज़्यादा मुश्किल होती है क्योंकि फर्स्ट तो फैमिली वाले ही इतना सपोर्ट नहीं करते कि हाँ, आप इतना आगे बढ़ रहे हैं। कहीं न कहीं मेन ईगो घर से ही स्टार्ट हो जाती है कि हाँ, मैं नीचे कैसे रह सकता हूँ, आप मेरे ऊपर कैसे जा सकते हैं, वहाँ से स्टार्ट होती है। फिर अगर हम जहाँ पे काम कर रहे हैं, वहाँ पे भी अगर मेल पर्सन होते हैं और अगर हम उनसे ज़्यादा अच्छा काम करते हैं या कोई हमारे को एप्रिशिएट कर देता है, तो वहाँ से स्टार्ट हो जाता है। तो हाँ, ऑब्वियसली बहुत ज़्यादा है। मतलब लेडीज़ों के लिए काम करना इतना और इतना आगे तक आना, तो डेफ़िनेटली
Okay.
काम बहुत करते हैं, लेकिन कहीं न कहीं उनको नेग्लेक्ट किया जाता है।
मैं आपका ट्रांसलेट करती हूँ. If we can just return to everybody in the panel, because I'd like to explain what Asha just said, especially for the benefit of Joan. Joan, basically Asha said the male ego starts at the home. Forget going out. The male ego starts at the home. The men at home start thinking, how does the woman have a more purposeful place, a role than me? And how she was under enormous pressure from her family, especially when she was working at the front line during the COVID pandemic, to stop working, but she did not stop that, and she felt she really needed to work. Ameera, let me go back to you. You've spoken about how you conquered those self-esteem issues. You've spoken about how women professionals are not regarded as complete unless they tick certain boxes on the personal front. But for you personally, how did you manage to do, quote unquote, punt on yourself? What did you channel inside you to grow Metropolis to where it is today when it was a single laboratory? Like, how did you convince your father?
There's a quick announcement for all the guests.
Actually, it wasn't hard to convince at all.
Joining
he always had his own dream of wanting to make it into a chain. But having been a doctor, he just realized that he didn't have the skills and the background and the education that was needed to really scale it out. So when I came back from the US, I had this dream to really make it into an institution and not be linked to sort of an individual. And thankfully, he and I were very much on the same page where I would run with it and he would sort of take a step back. So for the first 2-3 years, we worked closely together. He brought the technical knowledge, I brought the business knowledge. And then since then, he's sort of been more non-executive. But I think for me, initially, it was all about the passion for India. When I came back from the US, I'd only been away for a few years, but I was 21 and I was like, if I'm so privileged to get such an amazing education in India, I have to give back to my country. And that's how I came back here and I said, I want to do something meaningful in healthcare, and started to build the chain with the belief that basically we could and should bring global services and quality to Indian people. There's no reason why our level of healthcare should be any less here than it would be somewhere else. And the diagnostics at that time just wasn't available in India.
Yeah, and I'd love to hear more, but I'm being told that Sangita Reddy is now able to join this conversation. So let's actually welcome her to the panel. And Sangita, if we can, there you are. Dr. Sangita Reddy of the Apollo Hospitals is with us. She's been trying very valiantly on a phone line from Thailand to join in for the last many minutes. So Sangita, thank you for your patience and apologies that you had such a tough time joining us. But it's great to see you here, because I was just sharing with the others a story that you've often shared, that growing up as one of 4 daughters, the youngest, you would say that your father, Dr. Pratap Reddy, was described as poor Dr. Reddy, and you were determined to get him to the point where everybody would say, lucky Dr. Reddy. How tough was that to do? How many years did it take for people to start saying, lucky Dr. Reddy?
So, Barkha, good evening. And let me first begin by saying that on the eve of International Women's Day, I'm glad you're bringing the focus on women in healthcare, women in leadership roles, and the much needed impetus to enable women to really play a larger role in the overall ecosystem. I would like to say that it didn't take too long once we started working, but the initial period where the lack of credibility, the lack of a certain acceptance would not have been more than a few years, but it is something which is won incident by incident by the work, the determination, and the capability. And as you probably know, Apollo Hospital was last week brought on to the Nifty 50 as an acknowledgement of our size, our scale, and our contribution. And in one of the editorials, it was very nicely said that Apollo was started by Dr. Reddy, but is now being run by his 4 daughters. And I think the world now acknowledges that women are good leaders. So thank you for this focus, Barkha, and it's fantastic that you're having this conversation. Thank you.
Thank you, Sangita. But let me ask you before I return to the others, and then I just want everybody to come up and for us to spend 10 minutes talking amongst ourselves. The disparity in leadership roles and workforce figures, that 70% of women form the global healthcare workforce, but only 25% occupy leadership positions. Your family, Ameera, who's here with us, the head of Metropolis, you're still exceptions. The fact is that it is still men who are leading the healthcare universe globally. How do we close this gap? I know you're running a hashtag on Twitter calling for people to break the bias in even the healthcare world where sexism is often subliminal. So speak a little bit about some of the sexism even you've had to encounter.
So, Barkha, I can talk about different instances, but honestly, I think that we have been able to very quickly establish the fact that women, when having the right opportunity, are able to win the respect of their colleagues. So to be very honest with you, I personally have not really faced too much. But the fact is that there are many women, and therefore it's important for us to focus on the positivity of what women can create when given the opportunity. I often say that it's not where we stand right now, which is the point you made on about only 25% women leadership, but it's the direction in which we're going, which is upward. And it's the pace at which we're going there. So I would like to focus on the positives. I would like to say the base is STEM education for women, acknowledgement of women in all spheres of life, and empowering them so that they can take that rightful place. That is really the crux of the situation. And I'm sure all of us can do it together. Thank you.
Okay, so you're optimistic. Let me just get Dr. Joan Benson of Merck to actually respond to that. Joan, do you share Dr. Sangita Reddy's optimism? Because, in COVID, we actually saw that even when it came to access to vaccines, there was a difference or a disparity between men and women.
Yeah, it's interesting. And I do share her optimism.
Go ahead. Please do go ahead.
Yeah. Yes, it was corrected, and it's. Thank you. I do share her optimism. I mean, we've come some ways, but there's still a long way to go when it comes to acknowledging, women as leaders. But I even the very way in which we're framing this and talking about women as leaders, when a man leads, they just say, "Oh, Jack, John, leader of so and so." Nobody says Jack, John, the male leader, or the man leader. But when it's a woman, then then you have all of the caveats. Woman leader. The connotation of that says that there's something diminishing about a woman as a leader, and that for me is somewhat problematic. Let me come to what you were saying about the disparities in COVID-19 immunizations. Remember that women are part of the workforce. So when government said that only essential workers could come into could go out to work, come out to work, and other people were staying at home to do their work. Right there, they created a disparity because The women are also caregivers at home. So they're supposed to take care of their children and families at home, and they're expected to work outside the home as healthcare workers. But given the burden, the significant burden, and a whole lot more burden being placed upon them, there was no sanctuary for these women. So on two fronts, they were being, I would say, assaulted in the fact that they were bearing the brunt as healthcare workers, bearing the brunt at home. And then when it came to being prioritized for immunizations, they were the last ones to be considered. There's a whole lot more to do. How do we get from where we are today to where we need to be so that when we're thinking about access to medicines and vaccinations, should no longer be about whether you're a man or a woman. We should consider both of them equally.
Yeah, I want to just take what you just said about this preface, this preface actually being patronizing in your opinion, that Jack and John are not described as male healthcare leaders. Dr. Shagun Sabarwal, what do you think about this? I think it's a lifelong battle that accomplished women go through. Do you want to be prefaced by your gender, or do you want it to be, irrelevant? And can it ever be irrelevant even if we try to disown it, Shagun?
Yeah, so I think that's a really good question. And I would say that while I also identify with what Dr. Joan just said, I do think that what we at WomenLift Health really believe, and based on our conversations with a lot of women who are a part of our, this leadership journey that we have, that a lot of times it is about our authentic selves. It is about women's authentic selves also being a part of who we are professionally. So I liked what you said earlier also, that the fact that we have to sometimes shrug it off and then go in and say, here I am, and I have to kind of degender myself, which I understand is sort of like the way we have to be, but it should not be. And the reason being that I think one of the things that is really appreciated about this experiential program that we have is that a lot of women say that rather than it being about what we need to add to you, what we need to fix for you, in our program, we really focus on them identifying what their style is. And that style could be empathetic. It could be a style that brings people along. Even our notion of what a leader should be is very patriarchal. It is about just going out there, just making these decisions and just, not having any emotions. So I do think that a woman leader can bring some qualities to the table that are currently lacking. And which is why we are not even reaching the health goals that we should be reaching, because we don't have enough health leaders, women leaders, because women will think differently. They may take decisions differently. Their styles may be different. And I think we need to, celebrate that. We need to kind of reimagine leadership in that sense. So that's what I would say. But I can understand, that many times we have to be like, why is it like for women it's a woman leader but not for a man, so that's my perspective.
So that's two very differing perspectives. Asha ji, let's ask our Asha worker Rama ji what she thinks. Rama ji, यहाँ पे ये चर्चा चल रही है कि क्या औरत एक अलग किस्म की लीडर है आदमी से? आपको लगता है कि आप औरत होने के नाते मुद्दों को अलग नजरिए से देखती हैं?
नहीं, मैं अगर लीडर होती तो, या मैं अगर उस तरीके से देखूं तो मैं दो को अलग तरीके से नहीं देखूंगी, लेकिन मुझे पता है कि जेंट्स जो होते हैं वो देखते हैं अलग तरीके से। उनके में होता है कि जो लेडीज़ है वो हमेशा अभी भी कहीं ना चाहे कितना भी ब्रॉड माइंडेड मतलब हो गया समाज, कितना एजुकेटेड हो गया, लेकिन मैं जानती हूँ, मैं फील्ड में काम करती हूँ, मुझे पता है कि कोई कितना भी पढ़ा लिखा इंसान हो, लेकिन वो अपनी वाइफ को हमेशा नीचे ही समझता है। अगर वाइफ उससे ज़्यादा पढ़ी लिखी है, ज़्यादा अच्छी सैलरी है, उसकी जॉब करती हैं, तब भी वो घर के अंदर जो है ना, वो हस्बैंड से कहीं ना कहीं दब के ही रहती है। और पता नहीं क्यों ये एक अभी भी मेंटालिटी है लोगों की कि लेडीज़ है तो उसको नीचे ही रहना चाहिए, उसको नहीं बोलना चाहिए जेंट्स के सामने, चाहे वो अपना ओपिनियन कितना भी सही हो, वो कितने भी कितना भी उसको सब पता है कि मैं राइट हूँ, लेकिन कहीं ना कहीं अगर वो कहें तो वो जेंट्स से नीचे ही रहती है आज भी।
So this is very interesting. Let me take this back to Ameera and Joan for last comments. Joan, basically Ramaji says that she doesn't think that women make different kinds of leaders. She thinks men are the ones who insist on that differentiation, and that's why women end up fighting. And I think that's kind of true, that women are forced to differentiate themselves, and that is why you see women in healthcare, because there are so many more battles they're fighting compared to the men. So she's underlining the differentiation by men.
I absolutely agree with Rama, and that was why I made the comment earlier on about not just thinking of walking into the room and thinking of myself as a woman. Yes, it is true. I come into the room, I bring all of my feminine experiences to bear in that leadership role. But me as a person, when I'm engaging with different kinds of people, I also have experiences from the man's perspective, because I live in a world that's not just female only. So I'm experiencing things from a male perspective, from a woman perspective, from a child's perspective. There's so many diverse experiences that shape our own experiences as a woman. So if I walk in there into a room as a leader and I put aside all those other experiences, I'm doing myself and I'm doing the people I'm serving a great disservice. So I couldn't agree more with Rama. It's the man who perceive that a woman coming into a room has a certain, level of, ownership and contribution, and they try to pigeonhole you into that. But we need to just walk away from that and say no.
Yeah, Ameera, last word to you. Is it that easy to walk away from that and say no? Is it that easy to resist being pigeonholed? What is the one sort of lesson or the life lesson that you would offer from your own lived experience to all the other women in this audience today who are watching this, being inspired and could borrow from?
Well, I think, Barkha, for me, I think, look, the world is not going to change at the pace we want it to change, and that's just the reality of it. While we must keep educating, keep building awareness, keep talking, keep sharing, people will change at their own pace, and the only thing that we have control of is ourselves. So at least my theory in life is I should keep working on myself. And my biggest asset in life is not my jewelry, like my Indian society has told me to believe. It's not my looks. It's not how I present myself. It's my confidence. And as long as I keep working on my confidence and know that I am smart and I'm good and I'm kind and I can be all the facets of the things that I want to be without somebody defining it for me, then I think I can keep carrying on in my journey and be as contrarian or as non-contrarian as I want to be. And so to me, really, that's just my theory for my life, is care little about what people say. Do what you need to do to make yourself comfortable, happy, and in from a good space. And just keep focusing on that confidence as that asset.
I actually love that line, that don't care about what people say and focus on your confidence. And I think women, unfortunately, we just have to have a thicker skin about all the many judgments that are offered our way. Let me bring up our panel once again, just to say thank you to an incredible set of women. I said women leaders, but I'm saying it consciously and knowingly. Dr. Joan, Benson, Ameera, Shah, Dr. Shagun, Sabarwal, Rama ji, and to Sangita, who unfortunately was not on the greatest line, but we got her in just for a bit. Thank you so much. I think healthcare has never been as important. The compassion, the courage, the conviction of women has never been as important. And all of you have led by example. So thank you for your service and congratulations on your success. May you keep shining and leading the way. Thank you so much. Thank you.